Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Joining us today is Dr. Nicholas Moss, the Interim Health Officer for the County of Alameda. Please note, all participants have been muted. To submit a question for the Mayor or Dr. Moss, please use the chat feature. All of our town halls are recorded and available on the city's website and our YouTube channel. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you so much, Sarah, and welcome to all of you. I'm so glad you could join us today. We have a really special guest, and I know that you probably have questions that you're going to want to ask him. Sarah, do you want to just let people know how they can ask their questions?
Sure. So everybody can ask their questions through the chat tool, and we'll get it, and we will moderate those questions. You can also ask questions if you're listening on Facebook Live through the Facebook channel, and I'll try to get that as well.
Perfect. Thank you. So our very special guest has taken some time out of his very busy schedule to join us today. He is Dr. Nicholas Moss, recently named as the Alameda County Interim Public Health Officer after our previous Public Health Officer, Dr. Erica Pon, who had been a guest on this show, was named to be our state's epidemiologist, and so is off to Sacramento doing very important work on a statewide basis here. But Dr. Moss has been in the Alameda County Public Health Department since 2013. And before that, he was with the San Francisco Department of Public Health, where he was the Director of Clinical Prevention and HIV Prevention. He is a graduate of UC Irvine Medical School, and he's also a Bay Area native with an undergraduate degree from UC Berkeley. Go Bears. So without further ado, I want to turn the floor over to Dr. Moss, who is going to talk to us about all things COVID-19 and answer your questions and some of mine too. So Dr. Moss, again, thank you so much for making time to speak to Alameda residents and business people, and we are excited to hear from you. Welcome.
Thank you so much, Mayor. I'm excited to be here. It's an honor, and I appreciate all the work that you're doing. We've had a chance to correspond a little bit and be on some calls regarding the COVID pandemic, and I think your leadership for the city of Alameda has been terrific, and I'm really happy to be here speaking to your residents about what's going on today with COVID.
Thank you.
And should I, is an overview helpful? I know Q&A is very helpful, but
yeah, both, all of the above. I think, why don't you give us a little overview? I know some of our residents follow the dashboard on the county public health website. I was there just a little while ago, but give us a sense of what those numbers mean. They alarm me, and also how we can control those numbers, what we can do. I know we have heard that we are on the state's monitoring list. I'm sure residents would like a better understanding of what it means to be on the monitoring list, and more importantly, how to get off. Yeah. And I can see that we've got a number of business owners in the audience here, and they are working. Some of the businesses are closed altogether, and others are working. Restaurants can only serve takeout and delivery, or outdoors, retail. We have to limit the number of people who come in. So I think that, maybe if you could start out and talk to us a little bit about these numbers we're all living with.
Yeah, and so there's a couple things when you look at our dashboard, or when you hear, members of the public hear us talking about the COVID epidemic. And one is the overall number of cases in Alameda County, which is almost 11,000. And if you include Berkeley, which is its own separate health jurisdiction, we're actually over 11,000. Now that's the total number of people who have been diagnosed with COVID-19 in Alameda County since the beginning. And our first case was, I think, the last day of February. And so that's a useful number. It tells us a lot about the burden of COVID in Alameda County over time, but it's not the number of people who have it right now. that's closer to about 1,000, 1,500. It varies. So when we think about who's infected right now, what I think about from a public health standpoint are the people who could pass it on to others. We know some people take a while to get better, and so I don't want to say that you're recovered 10 days after your symptoms first started, because for some people it can take longer. But people are only infectious for about 10 days after they got sick. And so we have about 1,000, 1,200, something like that at any given time that we know about. There are more people who get infected and they don't go to the doctor. They might not have serious symptoms. And so we don't know about them. And that could be anywhere up to 10 times as many at any given time. So it could be 10,000 people with COVID in Alameda County at one time that could pass it on to others. Those numbers change over time, but that's where we are today. And then, I'm a real numbers person. I trained, in addition to medicine, I trained in public health and epidemiology, and that's all about looking at the numbers and what they're doing. And no one number is perfect at telling us what's going on with the epidemic. In fact, none of the numbers are perfect, but we look at a bunch of different, what we call indicators, to try to get a sense of how things are affecting us. And when you hear about the state monitoring list, that's really the same thing. It's a set of indicators that the state has determined are important, and we agree, and that we look at how the county is impacted by COVID using those indicators, those numbers, and get a sense of where we are. And so the big ones are not just that total number of cases, but actually the number of cases reported on a given day compared with the overall population of the county, what we call a case rate. And so, to be on the watch list, what the state is looking for is if you're seeing more than 100 cases reported per day for 100,000 people living in the county. So for all of Alameda County, that's around 170 cases reported per day. That puts you, that flags you for the watch list. And so we're right around that boundary right now. Some days we're above 100, some days we're below 100. And some of that is because we do a pretty good job of detecting cases in Alameda County. We have a lot of testing. We're trying to direct testing to the communities that need it most. And we're finding cases. So that's a good thing, but it keeps that number up high above that 100 threshold. When our case rates drop below 100 per 100,000 for 3 days, then we're hopeful that that'll get us off the watch list. That's what's kept us on recently. Another thing that we look at very closely is our hospitalizations. And so, one thing about a respiratory virus like COVID is it's hard to control completely. It's out there in the community, it's spreading. We know that as long as we have people going back to essential work and things like that, that there's going to be some spread. But we want to protect our healthcare system. We want to make sure there's beds available for people who need important surgeries like cancer surgeries, or people who come in for heart attacks or strokes, things that aren't necessarily related to COVID. And so a big part of this, when we originally were talking about flattening the curve, that had to do with protecting the healthcare system and making sure that that space was available. We have had in the last 10 days or so, and Mayor, you probably know this, some of the highest numbers of people hospitalized in Alameda County since the start of the pandemic, over 200 people. And so we follow this number really closely. And we also follow the number of people who are in intensive care unit beds. And if those numbers are concerning or they're going up too rapidly, that also could flag us for the state's monitoring list. And so while the numbers are high and increasing, they're not increasing very rapidly. So with luck, they will stabilize, our case rates will stabilize, and we'll eventually get off the monitoring list.
And Dr. Moss, is that, when they look at hospitalization rate, is that both the ICU beds and regular med-surg beds?
Yeah, they look at the percentage of ICU beds that are occupied and the percentage that are available. And so we have about, when I last looked, around 25 or 30% of our ICU beds available, which, and the rest of them are taken up not just by COVID patients, which is around about 60 right now, but also other ICU patients. maybe somebody got in a car accident, they need to be in the intensive care unit for a while. So, you know, we're okay. In fact, I was on a call with some hospital teams last night where we have a team here that we want to work with hospitals, making sure that they have everything they need to keep operating and seeing patients safely. It's okay. I think we're not in a bed crunch kind of situation right now, but it's also summertime. We don't have people sick from the flu and these other things. And so we're also trying to look into the future and make sure that we're not going to see a worse surge of cases in hospitals, say in fall and winter when flu season is here. So that kind of factors into the decision making as well.
Thank you. And then there's some more indicators, correct?
Sure.
Yeah.
Anything specifically that you feel like your residents would want to hear most about?
Sure. Well, I think where to begin? I think that so I want, and I think this is a shared desire, to get our county off the monitoring list. I don't have a lot of say over what goes on in other cities, but certainly Alameda residents can do their part. And I will say proudly that I do notice when I look at the dashboards that we are among the cities that have a lower per capita rate of COVID cases. I think it's about 214.7 today, but then as you've told us, that means from the beginning of when the statistics were being kept. But what's the most effective thing we can be doing to get off that monitoring list?
Well, first of all, I think this is a good chance to thank Alameda County residents and City of Alameda residents for all that they have done and put up with to date. We definitely have a lot of cases right now. It's concerning. We're not alone in that. It's true across the region, across the state, and really it has been true across the country over the last 6 weeks or so. But here in Alameda County, we've moved very slowly, and although we have this surge, I actually think that things could have been much worse, and I appreciate greatly the sacrifices that have been made by our residents and our businesses to really stay home, to keep to their households, to wear face coverings and those kinds of things. We certainly can do more, and those are some simple things that anybody can do to try to not just protect themselves, and we're learning more about how any face covering, I usually use this bandana. It's real simple, something you can grab from around the house. But any face covering can protect people around you. But also we're learning more that even simple face coverings do probably provide some protection for the wearer. So face coverings is a real important thing that we're going to be able to use to try to get those case rates down as low as possible, try to protect our hospitals, and protect our most vulnerable community members, the people who are at risk for severe illness. And Mayor, I can talk about who those are if you think that would be helpful.
Sure. And one of the things I hear from my residents, and they email me and call me almost on a daily basis about being very upset about what they've seen. Most recently, I got a report that in one of our parks on a nightly basis is apparently a pickup soccer game attracting 40 or so participants, none of whom are wearing masks. And I would say when I'm going out and about walking in our downtown districts, I am the nagging busybody mayor, but I just feel that it's really important now. My children will tell you I have a black belt in nagging, but I actually carry a little Ziploc in my, and not so little Ziploc in my purse at all times with fresh masks. And if I come upon someone who's not wearing a mask, I whip out my bag and say, did you know that it's the public health officer order to do this? I'm running at about a 50% success rate, but that's still 50%. But the ones who generally just brush me off tend to be the younger ones who say, I'm fine, I'm not going to get COVID-19. But why don't you tell us, because you can do it from a medical perspective, who should be most concerned about
Well,
COVID?
yeah, I thank you for bringing this up. 75% of our COVID cases reported to date in Alameda County are in younger adults, actually, people from the ages of, up 50 and under, and including people right down into their teenage years. So It's absolutely something that can affect younger adults and young people. Young people can pass it on. They can bring it home to their families and their households, and they can expose people that may have some of those risk factors for severe disease that we get concerned about. So that's older adults, but also people with medical conditions, and you can't always tell who in your circle has those medical conditions. So I think it's important for younger people to realize that they can certainly get COVID, they can get severe illness, and they can pass it on to people who can get severe illness and end up, in the hospital or even passing away from it. So I think it's, taking these simple steps in our lives to protect each other and our neighbors are really important and are going to have a real impact. And younger people are affected by these things as well.
And I was on a town hall, or watching a town hall last week, and there was an epidemiologist and I think biostatistician from UCSF talking about how this is a new disease. It's why it's the novel coronavirus. And so we really don't know things like the lasting impacts or damage to organs that could be a result of having COVID-19. And by the way, I think I forgot to mention that Dr. Moss is also an infectious disease specialist. So talk to us about what you think the most effective ways of getting people to wear masks are. I know that our neighboring county, Contra Costa County, just this week, their Board of Supervisors voted to start to do enforcement efforts and fines that add up after the first or second infraction. And I'm not even sure who's doing that, who's issuing the citations. If it's the county, maybe it's the county sheriff. But what are your feelings about getting people to wear masks?
Well, I think first and foremost, we want to educate and reach out and support people, help people get access to masks. That's why I think, these just simple household fabrics, it's not really much of a barrier, right? You don't need a fancy medical mask to do this. So, we want to educate people that it's just something you can grab, an old t-shirt. And you don't even need to be crafty. That's what I like about the bandana. It's ready to go. So just educating people, it can be something really simple, and that it is very effective, and it's something that'll help protect neighbors and loved ones. So that's our first, that's the first place we want to go. We of course want to reach, we want to work with trusted community partners. Sometimes, me on a conference call, maybe that's not always the best way to get the message out. So in some neighborhoods, we're trying to work more closely with trusted community partners. I think working with trusted local officials is very important as well, to just say, hey, look, this is something that we can all do that's easy, that's going to help everybody get back to work, get back to some semblance of a normal life. And then in terms of what Contra Costa is doing, so we're looking at that as well. I think it's complicated. We certainly want to we want to avoid doing anything that's going to be too difficult for some of our most vulnerable community members to deal with, right? So if there's fines, we want to keep those reasonable. We don't want to create additional economic hardship upon what people are already experiencing. We want to work mostly with businesses and try to partner with businesses, but also make sure businesses are doing everything they can to keep their customers and workforce safe. And I think what Contra Costa is doing is along those lines. But there are some challenges, and so we want to make sure that we are doing all of the low-hanging fruit first in terms of supporting people to make these healthy choices. And there's precedents, seat belts, bike helmets, things like that. I did a lot of work in HIV before, and condoms was the big thing, right? And if it's sometimes counterproductive if you kind of wag your finger at people and make them feel guilty and blame people everywhere. And we really find support and education can be very effective and helpful for a lot of people. sometimes you do need to reach for that citation, but we're hopeful that, in Alameda County, we can get there without those enforcement-based measures.
I'm all for trying a positive approach first. I will share that our businesses, I was on a business town hall the other day with some of our restaurant owners, and I talked about the importance of adhering to the public health officer's order, which is that even though outdoor dining is allowed, you must still keep your face covering on except when you're eating and drinking. And that if everyone would just do that, it's going to help our businesses stay open and more businesses open and get us off the monitoring list. So right there on the spot while we were talking, one of the restaurant owners came up with a sign that I think our economic development office is going to make copies of, that can be posted at the entrance of patio dining. Waiting to order, mask on. Wait at this, but anyway, I thought it was very creative. And then we're also taking a page from something that the City of Chicago's Recreation and Parks Department did, and starting tomorrow in our parks we will have they're going to be called park ambassadors, but they will be going around and they will have bags of masks, and anyone who's not wearing a mask, they'll go up and politely explain that you're required to wear one and give them one. They have no enforcement capabilities, and I understand they're also carrying bags of Alameda swag, whatever that is, that for those who are compliant, they'll get a prize. So we're trying the positive approach, but this is so important because right now our schools are not going to be allowed to open for in-person instruction. Is that right? Do you want to talk a little bit about that? I think we have some parents of school children on this town hall.
Yeah, I think this has been one of the most difficult areas to sort out for COVID, and we closed as part of sheltering in place. Schools were closed usually by the districts very early on due to concerns about what it could mean for students and for staff. And right now, the state has required that districts or that counties that are on the monitoring list that you need to be off the monitoring list for 2 weeks before you can allow in-person education. And honestly, in Alameda County, we're still going to look and try to determine if it seems safe and schools have everything in place they need to open safely, even once we're off the list for 2 weeks. And that's going to mean, systems in place to keep students physically separated from each other, which is a tough thing to do, especially for younger kids. And to protect staff and to respond when there are cases, because there's one thing that we've learned about COVID, it's that when you get people together, it spreads. And so we are going to see some cases in school, and that's probably unavoidable, but we want to make sure the systems are in place to respond to that. And I think we're not quite there yet. So we work closely with the Alameda County Office of Education, try to make sure school districts have, first of all, clear information about what they should be doing, and then trying to support them to get everything in place to open safely. But it's actually going to be, I think, a heavier lift than everybody had hoped, even earlier in the summer. So, I think I'm urging more patience here. I know it's very difficult for families and it's not great for kids, but I think that's where we are today.
Dr. Moss, talk to us about how testing will factor into schools being able to reopen.
Yeah. So, testing has been in short supply off and on throughout this, and the more cases that we have and the more COVID that's out there, the more testing we need. And the more people we bring back and the more sectors we open up, the more testing we need. And schools is a big example of that, right? We're talking about thousands, if not hundreds of thousands of students and staff starting to be more, to mix more because of coming back to school. And so in order to really do that safely, we want to be able to detect cases early on. We want to be able to make sure that staff are staying safe. And that means making testing available, first of all, when there's a case. So if there's a case in a school, you want to be able to test anybody who might have been exposed, for example, people in the same classroom, or have other tools that you can use to make sure that you limit spread beyond that classroom. And then you also want to make sure that staff are not getting sick more frequently than other people, and that everything is in place to protect staff. And so to do that, you need staff to have easy access to testing. And that's a lot of tests. We're talking about a lot of tests. Still not clear, and we'll probably learn a bit as we go, how frequently people need to be tested or when exactly they need to be tested. I think it's always about striking a balance. You want to make sure testing is available to detect cases that are there, but you don't want to waste your precious testing resources unnecessarily. So, where that balance is for schools isn't quite clear, and we don't have to wait to have the answer to open, but we need to have we need to be ready for the first draft. And so, yeah, some question marks still about how to get that level of testing available to both kids and staff in a way that we can really protect schools when they're open for in-person.
And what about how long it takes to get a test result back? Because I know it can take up to a few days. And
Yeah. Well, testing is most important for people who are sick and for people who are known to be exposed to a COVID case, or maybe people who work in certain settings where they may not have a known exposure, but if they're a healthcare worker, they work in a nursing facility or a first
facing,
responder,
yes.
right?
Mm-hmm.
So those people, we really want to make sure they can get tests and get their test results in a timely manner. And right now, you're right, some of the big national labs that we really rely on have got so many tests coming in from around the country that there's just not enough supply to get those test results back quickly. And in that case, actually the test stops being that useful, right? Because we want people to know quickly that they're sick so that they can stay home. And we also at the health department want to know pretty early on so that we can make sure people are staying home and that their close contacts are also staying home. And so test turnaround time is a big problem right now. We don't have one single number that we're following throughout the county. We hear there's some improvement in some places, but it really is hard to effectively control the virus throughout our whole society if we can't get people who need testing when they need it most.
Right. And so then the other part of the testing equation, of course, is the contact tracing.
Mm-hmm.
And I know that the county has added more contact tracers, but do you have enough? Is there never enough?
I mean, I don't think it's that there's never enough, but we have more than we did. We have around 130 or so people doing the work that was a team of 7 back in January. We'd like to get close to 300. And we know that when cases started to rise in late June and early July, we did not have enough staff. And we were not able to interview everybody. We weren't able to reach everybody in a timely manner. We're missing some information about, what happened with those cases. So, it just happened that the virus expanded faster than we could expand. And now things are in a little bit better position. We're keeping up a little bit better, and we've added more staff. We're also more efficient. We have a new system that allows people to work remotely, which really helps a lot and allows us to better track our data. But we really would like to see case rates fall lower, and we would like to add more staff to really be in the best position to do that contact tracing. And we're trying increasingly, and I think if anybody heard me early on back in April and May, we were really trying to get the public health department to be the holder of all contact tracing. But, we are now really looking to partner more with community-based organizations, but also potentially with schools, for example, and businesses to do some of that contact tracing. We just want to support them to do it in the best way possible.
Well, I would say whatever we can do from the city of Alameda, please let us know. I bet you we have amazingly smart, talented, and very committed, community-oriented residents and businesses. So, excuse me, please let us know how we can help in that effort. And speaking of our community, I understand that questions are coming in, and so, and thank you so much. This is very, very informational and educational for all of us. But let's hear what the audience would like to know. Sarah.
Great. So I think so a couple of questions with regards to asking for the situation or the current status with the City Health testing site in Alameda.
Mm-hmm.
Somebody said that there's a notice on the website saying that DPH is trying to shut them down and it's not engaging with them.
Um, do you want to, let me give a little intro to that,
There
and
you
then
can start, yeah.
I'll let Dr. Moss take it from there. On my town hall 2 weeks ago, I did interview the CEO of City Health Urgent Care, which is has 2 urgent care facilities, one in San Leandro, one in Oakland, where they had been doing COVID testing in a clinical setting. And they had the idea that they wanted to expand the testing and do it in an outdoor setting, which was very ambitious and very well intentioned, but ran into some problems. And this has been out in the public. Among them, the owner of the property said, "My insurance doesn't cover this sort of usage." And then social distancing became a problem because although the test results were supposed to be delivered in 15 minutes, it was taking longer. And so people were coming in and they were accepting both appointments and walk-ins. And as people were waiting for their test results on site, they weren't able to properly social distance. And so, as I understand, public health department representatives made a visit last week. And Dr. Moss, I'll let you fill in any further details.
Yeah, so I think, first of all, we are grateful to the role that all the medical providers across the county are playing in testing and in supporting individuals who need medical care. And what we are, there are a lot of different regulations and things like that regarding testing. But what we want to do is just make sure that things are happening in a safe way and where people are getting accurate information that they can use when they get tested. And this is, we have this approach with all testing sites throughout the county. We want to support City Health and any testing site to be doing, have their systems set up in a way that all of the health officer orders are followed, social, physical distancing, face coverings, things like that. Make sure that both workers and patients or clients are as safe as possible, and that they're going to get the information that they need. I think what we've done with City Health is similar to what we've done more broadly, which is really just to try to make sure that those that all those things are in place. And I think organizations, when they set up new testing programs, this isn't about City Health, it's just speaking generally, and we've certainly seen this across other testing sites. There's always wrinkles and things that need to be worked out, and I'm always hopeful that folks will be able to set up a system that's going to work best for their clients and serve the communities that they're trying to operate in. I think beyond that, sometimes the public discussion doesn't always capture all the nuance of things like this. And, I hope your residents understand that we just want to have what's best for Alameda residents and Alameda County residents in terms of testing and medical services available to them.
Thank you.
So, two other quick follow-up questions on testing. Yeah. With regards to the rapid tests that are out there, are they reliable?
So there's several different rapid tests out there, and that are approved under FDA emergency use authorization. So they're sort of approved on contingency, given what the situation that we're in. And I think most of them have a role. Some of them are, I think we're learning more about, how carefully you have to use them to make sure that you're only using them in situations where you're going to get good, accurate information. In general, I prefer the lab-based tests, even with the slow turnaround times that we're seeing right now, with a few exceptions. There are some rapid, there's a rapid molecular test out there that I think is very good, but you can't test a lot of people in a short amount of time on that system. And then there's another rapid test, the rapid antigen test, that I think is really best used in only limited situations with symptomatic persons. And I believe the FDA authorization spoke to that. and it probably needs to be used in conjunction with some other testing. And so, there are just lots of caveats that we expect clinicians to, manage when they're using these tests. But the test that is used most frequently, there's a few different ones. There are molecular tests that are not rapid tests that get sent to a laboratory. Those are pretty good. It's just a question of that turnaround time and getting those test results back to people in a timely manner. And one last thing I'll say about testing is, if you're sick, don't wait for your test result. Please stay home unless you need medical care. The test result is important, but if you're sick, please stay home, because that's something that's easy to do even without the test result, and that'll protect people around you. We know there's COVID out there right now. And similarly, if somebody in your household is sick, you've been exposed, please also stay home. We're asking everyone to stay home for 14 days after they've been exposed, just to make sure that they don't get sick and pass it on to other people. And so those are things that residents can do even when a test result is impacted.
Thank you.
Somebody has asked if the tests from the City Health site in Alameda, are those being included in the county counts?
Any information that's reported to us that is a reportable test, and the state of California sets the rules for what's reportable. Anything that's reported to us does get included in the county counts. Serology tests, which are antibody tests that are not as useful for clinical diagnosis right now, more useful for like surveillance, trying to get a sense of how much COVID we've had out there in the county. Those don't count as tests because you can't diagnose a current infection with them. But those aren't the rapid tests, I think, that you were asking about. So, in general, tests that are reported to us, most of them are diagnostic tests, and those will get counted.
Great. Somebody's asked, when will there be a formal testing program available locally for our schools?
Well, it's going to probably be a process that shapes up differently by district and there's private schools as well, and so it's not going to look the same everywhere, and it's going to take some time, I think, to get something set up, and then we're going to have to be prepared to flex and make adjustments with that program as we go. I'm being honest with the school districts that the county, and I know this is true of other counties, most other counties with one notable exception, the county doesn't really have the staff or the lab capacity to test all of the tens, if not hundreds of thousands of people involved in schools. And so we're going to have to involve other partners in that, or maybe look for assistance from the state to make sure that schools have access to the testing they need.
Great. Somebody had asked about, back to City Health with regards to the Alameda testing, is it closed or open now? And then maybe answering that question, somebody else wrote in their question saying that the City Health facility texted them last night. They had an appointment and they offered PCR instead of the rapid results. And so they're wondering if they should wait a few days for the results or do the rapid. What do you?
Well, I try not to give out too much medical advice on these calls because often there's a lot of information that's not available to me. So I would just defer to the medical provider in that situation, make sure that you're getting clear information from them. And again, if you're symptomatic, you feel like you might have COVID, then other than seeking medical care, good idea to stay home. And then I apologize. I mean, I know the big picture for working with City Health, but I don't know some of the granular details. We have a testing team that's works more closely on that. So I'm not sure I can speak to all of the nitty gritty.
And I know that one of the issues for County Public Health was that at least initially, City Health wasn't reporting its test results to the county. And but I would also just echo Dr. Moss, and certainly if you feel you are symptomatic, call your doctor. I mean, I would encourage you to do that if that would be the best course, I think, for you. And some of our doctors do have testing; they can do the test in their office.
Quite a few, yeah. Or at least they can tell you where to go to get that test drawn by one of these commercial testing.
Exactly. Yeah.
Dr. Moss, earlier you were talking about the testing and the waiting time. This person has asked, what can the county do to improve the waiting time for test results?
Yeah. Well, that's a great question. So, it varies from lab to lab. Our own lab runs a little bit faster, but we're very small, so we're not able to really, provide more than a fraction. Something like 4,000 COVID tests are done every day in Alameda County, and our lab does about 100, 150 of those. And so it's many different labs, and it's the availability of supplies varies by lab. What's available to us to do as a county is to really make sure that we're using the tests appropriately. And so on the one hand, that's setting priorities and making sure that people who need the test most are getting tested. That's, again, people with symptoms, people that have close contact to a known case or work in a field where they're exposed to a lot of people. And then in Alameda County, we do want to make sure testing is available more broadly. We have there's asymptomatic cases out there, and we have some disproportionately impacted communities. East Oakland, not far from Alameda, has a lot of cases. And so we really have worked hard to expand access to testing. And so there's a bit of a balance there. On the one hand, we want to prioritize testing for people who need it most, but we want to make sure that there's testing accessible in the communities that are being hardest hit. And so we're trying to walk that line right now here in the county.
And everyone has heard me say this more than once if you've tuned into my town halls, that and the county, when I talk to the folks at County Public Health, they're very apologetic that Alameda has waited patiently to get the county to set up a test site here. But at the same time, we do understand that when hotspots erupt in various parts of the county, it is in all of our best interests that the test site be located there to get, to help people know if they're symptomatic or if they're positive, and then take the appropriate steps. And at the same time, if you go on the county health website, acphd.org, you can find a location for a test site, and the testing is free. And I also know from talking to public health officials that thousands of Alamedans are getting their tests done at these sites. Of course, we would love a site in Alameda, and I can tell you that city administration, we're working to locate another provider that might be able to come in so that we'll have a local location. So we'll let you know if it pans out.
And I want to just pick up on a couple of your points, Mayor. One is that we need more testing everywhere, including in Alameda. So I think we just want to get as much testing out there as possible. We have actually hit our original goal of 3,100 tests per day done in the county, and we've exceeded that. We're getting a lot of testing done, but it may be that goal was too small, anyways. And also, we want to make sure that testing is spread out, everywhere, so that people who need it can get it. And that means having it available really throughout the county. And then the last thing I wanted to say, and you made this point, I think in a way, Mayor, but if there's a hotspot anywhere, that can affect the whole county. And just because somebody's place of residence is in one part of the county, it doesn't mean that we're not seeing, for example, our workers or people needing to run, those essential errands. We're not seeing people move all around. And so we can't just focus on one neighborhood and say it's fine here, but it's not okay there. And it's all about keeping in mind that this thing does not respect lines on a map, and that's certainly true within Alameda County, but it's also true regionally. And we're really trying to have a better regional approach with reopening, similar to what we had with the original shutdown.
And I wanted to slip in a quick question. When Alameda County saw this kind of a spike in cases, maybe, I don't know if it was after 4th of July or just when, could you pinpoint it to particular causes?
Mm-hmm. Right. So the cases really started to rise in late June and into early July, as you said, and they were because of, as I mentioned, we got kind of overmatched in terms of our ability to investigate every case. So we're missing a lot of information. And what I tell you is based on the information that we do have, which is not all cases, but just a subset that we were able to really get that interview and find out, where they were, where they might have been exposed, that kind of thing. And it's also based, I just talked to the investigators, and when I'm on call for the county, I hear the stories myself. what's going on in your life? Where might this have happened? And sometimes we can't tell because people, well, I went to, I work at a hospital, but I also went to a party in San Joaquin County, but I also, live in a household where somebody else was sick. And then it's a little bit hard to assign exactly where that exposure might have happened. But we do our best. And I will tell you the themes that emerge. First of all, households, once it gets into a household, it spreads very easily, especially if people can't spread out, have a separate bathroom and bedroom for the person who's sick. And so that's been a problem, particularly in the neighborhoods most impacted in Alameda County, a lot of crowded households. Workplaces, just because people are out and about at workplaces, for those of us who don't have the privilege of working at home, you got to work shoulder to shoulder with somebody, maybe in a workplace that was still learning the best tools to keep the workforce safe. So we see transmission in those settings. Or break rooms. Break rooms are a big problem. People wear a mask all around work, but then they get together in the break room, they take off their mask, they're 3 or 4 feet from somebody, you get transmission. Parties, people were cooped up for a long time. They wanted to socialize, especially our younger population. They wanted to get together. And unfortunately, we do see a lot of transmission associated with those kinds of social gatherings, particularly indoors, but we're concerned that in certain circumstances, outdoors could happen as well. You got to keep that 6 feet of distance, got to wear that face covering. And then people always ask about the protests. There were a lot of protests around the country, and Alameda County included, early in June. And we have asked that question time and again. We have not seen cases tied to the protests. And I think there's a few possibilities. One is people just don't share that information, and we don't know. But I think if there was a signal, we would have seen it. Enough people are forthcoming with us about their activities. And everything people tell us is private and confidential, like when you go to your doctor. But also, they were outdoor. They were before our surge of cases at a low point in the epidemic in Alameda County, relatively speaking. And so there might not have been enough COVID in those crowds. People were wearing face coverings and they were on the move. And all of those things may have served to reduce the risk of COVID from protests. So to the extent that I know anything, I haven't seen any signal from protests.
Thanks.
I have one last testing question and then probably 15 or more questions after that. So I'm going to go through
have
these
to
fast.
speed talk.
Yeah, I
Yeah.
got to speak faster. I'm sorry.
Okay.
I'm long-winded.
We're going to be auctioneers.
The real quick last testing question is somebody's asking, why hasn't the county used the Oakland Coliseum parking lot for a drive-through testing site?
Yeah. Well, we've had drive-through testing sites in other locations, including locations in the Fruitvale and East Oakland. I think that's not an unreasonable idea. We're adding, we've added testing locations as best we can. There are some advantages and disadvantages to different sites, and we were partnering with third-party, clinics and things like that. So I think for a variety of reasons, the Coliseum hasn't come up yet. Fairgrounds did come up. There's been testing at the fairgrounds. So not a bad question, but we just don't have it.
Great. So on to face masks. Are the ones with valves okay?
Yeah, this is a good question too. So this is what I tell people. If it's at hardware store, you buy it at the hardware store for the home construction project and it has the little valve in the middle, it's a white mask. That's not very good. And the reason is you can breathe out right through that valve. And if you have COVID, you can spread those droplets through that valve. So we don't like that mask, even though it's a N95 mask. We don't like that one. I prefer a simple cloth mask to that. But there are some masks that people get, you can buy them on the internet. They have valves on them. Some of those might be okay. It's those white hardware store masks with the valve right in the middle. I wouldn't use those. Better to just use a cloth face covering. Great.
On to reopening. This person's wondering if or when we could open the playgrounds for children to enjoy.
Yeah, good question. So we're not opening anything right now due to the overall burden of disease that we have, and we're really not making any exceptions. We've been on pause really throughout the month of July. It's been a month now. I think we are seeing benefits from that, but it's a little premature to start adding things. I do feel like playgrounds, because they're outdoor, those are a place that are relatively safe, but you got a lot of hands touching objects and probably not a lot of cleaning. And so, I think that I would like to see less overall COVID in our community before we start saying that's going to be safe. Good question.
Great. This person asks, is there a process for businesses to be reclassified as essential? Their business is therapeutic in nature and basically an extension of physical therapy and chiropractic services. Many of their clients rely on them to stay healthy, so they're better equipped to combat the virus, but they're lumped into the gym category.
Yeah, or personal services sometimes overlaps too with like healthcare, and we understand that. People are welcome to reach out to our COVID recovery team. It's COVID, COVID recovery, RECOVERY at acgov.org. And I can make sure Sarah has that. And email questions about the health officer orders and what's allowed and what's not for businesses. That's really for businesses, not for the general public. We have another email address for the general public. And they can sometimes help kind of evaluate whether you fit into one bucket or another. And then for personal services, under certain rules, even if they might not be considered essential, we are hoping to get to a place where some personal services are open for outdoor work. So I encourage people to think about how they could safely run their operations outdoors if they're providing any kind of personal services. And I understand that's not easy for everyone, but it's a good thing to plan for, because outdoors does seem to be safer than indoors.
And are we talking, is that about haircuts and things? Is that what kinds of personal services?
Exactly.
Yeah.
A variety of personal services. And those are closed in monitoring counties like ours by state action. And we're not sure when the state, it's actually, even if we come off the monitoring list, we still have to wait for the state to lift those restrictions for us. But we do think at least outdoor personal services, we're hopeful those will be able to open sooner than some indoor stuff where we know the risk of transmission is higher.
That's greater. Thanks.
The next person asks if your crystal ball has any idea when we will have any indoor dining. They're thinking about the November, December timeframe.
Yeah, I mean, I think indoor dining is further down the list because it's indoor, because people don't have masks on, because it can be maybe a little bit more crowded in some spaces, even with that 6 foot. And so, I know when the rainy season, we started to get this question, what about when the rains come? How's it going to work? I hope we do have rains as always, but maybe it'll be a dry winter this year. So I think indoor dining is further down the list. We really want to see much less community transmission of COVID so that if those establishments are open and there are cases, we can really focus and respond quickly and shut it down. Right now, with the amount that we have, it's very hard to do that.
Got it. This person is a director of a preschool, and they've said that they don't know, they're asking this to you, Dr. Moss, if anybody in your department has gone out to look at preschools and private schools and how they're implementing their protocols, but they're doing the most robust protocol that this person has seen. And if you'd like, they'd be willing to share videos and that kind of thing. I can put you in touch if you're interested.
Sure,
we can talk about that offline.
Yeah, actually, we do have a schools team. We don't have a schools email address right now, so maybe just be on the lookout for that. For now, I think COVID recovery, that same email is reasonable for a school. It's basically sort of like a business, and we're happy to see what people have done. We don't do inspections of individual facilities because there's so many businesses and facilities in Alameda County, and we're not really that type of organization, as a public health department. So the exception is environmental health and restaurants. They continue to operate in that way.
This next person, similar, they said, could education businesses, so for example, tutoring or STEM program groups, reopen in the fall? Or could they have class outside if they reopen in person? Or how do they get, is it the same thing, the COVID recovery? Is that where they go to check out?
Yeah, I think that's the best place. And there are some things that are already allowed within certain parameters. And so, I would make sure to review the rules closely and see if it's not something that can already be opened.
Yeah, because we have certainly our Recreation Parks Department and some other private providers have been doing summer camp programs, not sleepaway, but that stable group of 12 with 1 or 2 leaders and the same children for 3 weeks at a time. And that's, I think our recreation programs have been very well subscribed. So it is, it is one of those things that we know that kids really need to be around other kids. And so to the extent that they can do so outdoors right now and safely, that's a good thing.
Yeah, I think those parameters you just described, Mayor, we really support that. We know, I think that was well said. We want kids doing more.
I've been hanging on your every word, you and Dr. Pond before you and Dr. Fauci. So.
And Dr. Pond is a pediatrician, so she really
That's
set
right.
the groundwork here at Alameda County to make sure that we're thinking about kids.
Right.
The next person, just thinking about businesses operating indoors, they ask if a forceful through ventilation system could be used instead of an outdoor offering.
I think it's a great question, sort of a bit of a hypothetical. Improved ventilation is good for indoor settings. And, we want to balance that against setting requirements that are going to be too hard for people to meet, too impractical. But I think, ventilation is good. It's a net positive. So the more ventilation, the better for indoor sites.
Great. The next person wants to become a contact tracer and wants to know how they do that.
So we haven't started, we've got a lot of interest from volunteers. I don't believe we've onboarded any volunteers, although Berkeley may have. We've worked more with county employees, some state employees. I'll try to find the email address for that just so they can send their interest. But I'll be honest, right now, we're not really onboarding volunteers. It may happen in the future.
The next person has asked a couple of questions with regards to local City of Alameda stats. So do we have the numbers of people that are in care facilities or the number of people that have recovered out of the number in total that we have? Do we have information on the ages of our cases or how many cases have come from the same household? Just trying to find a way to put the city in context with the county and see how we fit in.
Sure.
I'll hand that one off to Dr. Moss.
So city data is actually in aggregate, so not individual persons, but collected data is available on it's not the most user-friendly page, but there's a county data portal where you can look at data by zip code or for the whole city of Alameda. And I'll see if I can get that link. Sarah, you may not have that one at hand. And so that'll have some of that. It doesn't have recovered. Or that thing I was talking about earlier, I think that maybe, people are going to start to want to see, which is like how many people were infected in the last 10 days. So I don't think that's in there yet. And it might get in there someday, depending on whether there are privacy issues. Because when the numbers get real small, then we get concerned about privacy. And so some of that stuff is available now and some, may be added in the future. It's not posted on our dashboard. We only have so much room and there's a lot of cities in Alameda County.
Do you know specifically about deaths in the city of Alameda?
I don't know off the top of my head. Mayor, do you know?
I do not.
I had asked somebody about that, I think probably about 2 weeks ago. And as of that time, there had been none, but I don't know in the meantime.
Yeah, I don't have anything to add right now. And because the numbers are so small, again, it's a sort of a privacy thing. I don't want to be in a position to say, well, one person died in the city of Alameda and their family members on this call. It gets a little bit close. So although we have concerning deaths in Alameda County, the numbers are still pretty small, especially at the city level.
Great.
Thankfully, yeah.
For talking about the state monitoring list, do you know why the 100 per 100,000 was chosen as a significant measure?
I don't know what was the state's, I'm just posting this website here in the box. This is the data distribution site. I don't know I wasn't part of the state discussions. I think it's a reasonable number, and I'm not sure if there's some specific evidence that they were looking at. It's not an unreasonable threshold just in terms of a measure of the current burden of infection in a given place. And it can be applied to urban areas, rural areas, counties with more people, counties with fewer people. So it's, that's why they use that, use a rate. But I don't have more insight than that.
Okay. Back to reopening, can you offer any estimated timeline for when the county will offer guidance for the use of outdoor fitness swimming pools, not recreational pools?
Yeah, I think those outdoor things that are still closed, but that are, kind of individual or small numbers of people, that stuff is higher up the list. But again, we're going to want to see things really stabilize here. So I'm hoping that it's weeks, not months, but we're trying not to set timelines.
And I would just throw in my little advertisement that for all of you who are asking about asking reopening questions, and they're all really important, help all of us by doing your part to amplify this message that you want your business to reopen again. I want your business to reopen again. Talk to everyone you know. When you see someone going by without a mask, I read something yesterday that said, we want to make someone wearing a mask be reacted to the way we do when we see someone light up a cigarette inside inside where they shouldn't be, or at all. But that little bit of social pressure nicely, carry some masks, offer them. Like I said, I've got a 50% success rate. Anyway. Sarah, we need to wrap up soon.
Yes, I'm going to keep going as fast as possible. Okay.
Yes.
What is the likelihood that we would have to go into a strict stay-at-home period again based on the current surge?
Yeah. So earlier today, I was, in a discussion about this topic. So I think, a very strict stay-at-home. When you hear about what's going on in other parts of the world where they've got things under much better control, strict stay-at-home policy across the whole country, or at least the whole state, might get that done if it was maybe 4 weeks or so, maybe 6 weeks, long enough to really let all the cases kind of peter out and get that number down so low that, again, we could just really focus our resources on stamping out things when they pop up. But that's going to be a heavy lift to do statewide or across the whole country. And so we're kind of in this other position of just trying to keep things slow and under control as best we can, and it's more like the slow simmer. I think if we felt like we really had to do that to protect public health and protect our hospitals, we would, but it's unlikely to happen just at the county level because we're really impacted by what's going on around us. Right now, we're trying to move ahead without something like that.
What is being done to target or help those hotspot neighborhoods that you talked about earlier? What help in particular is given to the Latinx community?
Yeah, we didn't talk about this much, but our COVID epidemic in Alameda County vastly disproportionately impacting our Latinx community to the tune of something like 60% of our cases. A lot of essential workers and also a lot of households where there's crowding, part of that story. So we've worked to increase testing and partner with some of the clinics, for example, La Clinica and Native American Health Center, located in the neighborhoods of East Oakland, where those most impacted communities are. We have other impacted communities in the county that we'd like to do the same for. We're a little bit further behind. And we've also partnered around contact tracing with organizations that serve those communities, so that there's some, if you go to a clinic and get tested and positive, that clinic can do the contact tracing and has all the tools that it needs. It's still in the pilot stage, but that's another area where local trusted voices are doing that work. We're doing some neighborhood community outreach with some partners to reach some specific communities within the Latinx community, right? There's many communities within the Latinx community. All In is a countywide effort led by Supervisor Chan, and they are working in 5 impacted neighborhoods to try to address some of the specific issues in those neighborhoods. And then this is very premature, but I know that there's at least discussion at the county level about potential wage replacement that will help some of these essential workers safely and preserve economic security while people are staying home, which is a big challenge, I think, for people who just don't have a lot of resources. So San Francisco did something similar, and we're watching that closely.
This person says that they're frustrated that the powers that be never talk about the importance of immune health to reduce the chance of poor outcomes and better outcomes of those who do have more severe cases. Vitamin D status would be the best place to start.
Well, I think, yeah, overall healthy habits are very important in preventing COVID, particularly preventing the most severe disease. I like to try to, focus my own recommendations on things where I can sort of point to the specific data that speaks to COVID. But I think more broadly, there's a lot of things that people can do to support, their health and their immune health. And I encourage residents to do that, not just for COVID, but for, all of the things that impact our health.
Great. I know we're over time, but I have a couple of questions that are specific to schools. The first one was, if schools do have the capacity to put protections in place, small stable cohorts of kids, good ventilation, frequent sanitation, et cetera, are you open to considering waivers? Can schools be considered on a case-by-case basis?
So no waivers right now in Alameda County. We just have too much burden of COVID. And I think we're, even if and when we are ready for waivers, it's going to be with, a lot of plans in place for that school to make sure, that the school will have to create to show that it's ready to handle cases that occur. So we're not quite to waivers yet, but I appreciate that there are schools that can and will be ready to open, and we are going to, try to get to a place where we can support them to do that when the overall burden locally is low enough that it's, we can ensure public health is protected. And I'll say this about reopening, doesn't matter what the sector is, the more people that we have interacting, and that always happens when we open up more, the more cases that we're going to see. And if we do that at a time when there's lots of cases already circulating, that can get us back into a surge situation that we want to avoid.
This person is also talking about schools and wondering, why are all schools lumped together when the data is starting to reveal that elementary school age kids are less likely to get or transmit the virus? And then they also say that young elementary kids can't learn as effectively in remote settings as older kids, so the impact of remote learning is more detrimental to them and their parents.
Yeah, actually, I think great question. They're not all lumped together by any means. In fact, in-person learning would probably start for those younger age groups for the reasons that the questioner noted. But for teenagers who look a little bit more like adults from a COVID standpoint. Some question marks about that in-between age, middle schoolers. Somebody asked about waivers. If and when waivers are allowed, they will probably focus on those younger children for those reasons.
Great. And then this person asks if there's any chance the number of children per cohort in childcare will increase once the case numbers improve.
Maybe.
Mm-hmm. And then one last question, because I know we're so out of time. This person says, recently on Nextdoor, there's a statement made that nurses must use their N95 PPE masks for 8-hour shifts due to short supply. Are Alameda County hospitals really getting fully supplied for all staff? And are the supply chains working well for hospitals?
Yeah. So my understanding is the day-to-day supplies for most of our large facilities are okay, except gowns, which are a problem, but certainly N95 respirators are in short supply, and hospitals have to make sure they're complying with Cal OSHA, Occupational Health and Safety Regulations, which is not public health, but worker health. And so there's a lot of rules around, what can and can't be done. And there's some emergency rules as well. We have a system for hospitals and others to request emergency supplies of equipment, and we are continuing to get a lot of requests in that system. So, we know there's a need out there. And I think although the day-to-day supplies are okay, the supplies to support weeks of surge are limited. And that's a statewide and national problem.
But the question seemed to include a phrase about nurses being required to wear the N95 for an 8-hour shift. Are N95s supposed to be worn for a shorter period of time, doctor?
Yeah, I thought they were, and I'm not sure what, and I'm not as much of an expert in that particular aspect of N95s, but I believe you're right, Mayor, that they're typically supposed to be worn just for a few hours at a time. But there are some emergency guidances and regulations, including put out by CDC, that speak to ways to conserve mask availability. And so they do set some parameters for things like that.
Thank you. And you know what? I just realized we are almost
Yeah.
15 minutes over time. And so on behalf of my community, our community, Alameda, our businesses, our residents, thank you so much, Dr. Moss. This was a wonderful, informative discussion. And I always think that if we're armed with good information and facts, that just helps us go out and better protect ourselves. And I can see people applauding already. If we were all unmuted, you'd hear applause. But thank you so much. I'm so grateful for you for taking time out of an incredibly busy schedule to join us.
My great pleasure to be here, Mayor. And I think this is really the job, is getting out and speaking to county residents. So I'm always happy to do this work and share, what we're doing and just try to help support public health. So thank you for giving me the opportunity.
Thank you for all the good work you're doing, keeping us healthy. Take care. Thank you.
Bye.
All right,
Take care.
everyone, until we see you next time, take care, stay safe, wear your masks. Thank you. Bye-bye. Thanks so much, Sarah.
Bye, everyone.
Bye, everyone.